Hi, I'm Dr. John Rolland. I'm the author of the paper in Family Process called Neurocognitive Impairment, Addressing Couple and Family Challenges. I'm the co-director of the Chicago Center for Family Health and the professor of psychiatry at Northwestern University. The primary focus of my work over the past 30 years has been couples and families facing a broad range of serious illness and disability across the lifespan. During this time, I have developed the Family Systems Illness Model, which is based on the premise that all family members are affected by major health conditions, and the family system is the hub of the psychosocial wheel for coping, adaptation, and positive growth. The model attends to the systemic interaction between an illness and a family that evolves over time. Conditions involving neurocognitive impairment, such as dementia and traumatic brain injury, present such heart-wrenching challenges for individuals and families and their loved ones. Because these conditions alter the capacities for relational connection in varied ways, they can profoundly affect couples' bonds and family life. However, research and practice has tended to focus narrowly on the individual caregivers and their dyadic relationship with the affected member. What we need is a broad family systems approach with attention to family processes over time. So in this paper, I apply my model to providing a guiding framework for a broad spectrum of neurocognitive conditions and their evolution over time with individual, couple, and family life course development. Besides common dementias such as Alzheimer's disease, many chronic conditions can cause neurocognitive impairment, such as advanced heart, kidney, and liver diseases, metastatic cancer, and chronic alcoholism, just to name a few. Case examples will highlight principles and offer guidelines. I address key family and couples issues with mild to severe cognitive impairment and progressive dementias. This includes challenges related to communication, multi-generational legacies, and threatened future neurocognitive disability. I address issues for adult children and spousal caregivers, ambiguous loss, decisional capacity, reaching limits, placement decisions, and the transformation of intimate bonds. Using the model, I will discuss psychosocial types of neurocognitive conditions based on the pattern of onset, course, outcome, disability, and level of uncertainty. Understanding the expectable pattern of cognitive impairment over time can help families to organize patterns of living and anticipate future challenges. Progressive, relapsing, and constant course conditions present distinct challenges. Progressive conditions such as Alzheimer's disease present families with new and increasing challenges over time. With neurocognitive conditions, it's crucial to include the patient's wishes and preferences in future planning early on. In families holding old relational wounds, addressing grievances can prevent disappointment and complicated grief and can maximize quality time. If cognitive functioning can worsen suddenly and dramatically, such as with a stroke, the urgency is even greater. I will incorporate the dimension of illness time phases. I identify major developmental phases in the evolution of cognitive conditions over the initial crisis, chronic, and terminal phases. These broad illness time phases interact with phases and transitions in family and individual members' personal development. For instance, in one case I discuss a 42-year-old woman with MS and increasing cognitive impairment who has returned home to live with her parents who are in later life with their own health concerns. Her brother is married with small children and other responsibilities. The patient's cognitive difficulties will need to be considered in relation to these other life cycle challenges now and looking towards the future. I hope this has piqued your interest in taking a closer look at my paper. Thank you very much.